The placebo effect has been known about for ages and always been considered hugely important. In the history of medicine, the great monument Stonehenge may actually have been a kind of placebo hospital, a place to which people came in order to receive faith cures. What they did, we believe, is to touch the stones and through them absorb, as they believed, some magically potent medicine.
The history of medicine up until really rather recently is by and large the history of the placebo effect, that doctors relied a lot on the force of their personality and aura of being a healer. Then they were able to rely on things that they could pull out of their black bags.
In fact, the power of the placebo was once so recognized that medical catalogues sold placebos, pills of different sizes and colors which contain nothing but chalk or sugar. Doctors no longer officially prescribe placebos, but does it still go on behind our backs?
Physicians are intimately familiar with placebos. In a survey by the National Institutes of Health, half of the physicians surveyed admitted that they've treated patients with placebos.
A confidential survey of 200 GPs done for Discovery by NOP in July 2002 reveals a shocking truth. Asked, have you ever knowingly prescribed a placebo? Almost 2/3 of doctors said, yes, they have. In the UK, 63% admit to prescribing placebos, in clear defiance of the unwritten rule that placebos should no longer be given to patients.
Placebos are made of inert substances like sugar and used in clinical drug trials to prove the efficacy of a real drug. In clinical trials, one group of patients receives an experimental medicine and a second group receives a placebo. In theory, this gives scientists an objective way to measure whether a medicine actually has an effect on a patient. These double-blind, placebo-controlled tests are used throughout the pharmaceutical industry, and a drug must beat a placebo in at least 2 trials to gain FDA approval. Seems simple, except that is, for the placebo effect. Some patients who take the fake medicine also experience improvement in their symptoms. Sometimes, placebos even outperform real treatments.
For example, the same placebo can treat pain half as well as aspirin, while at the same time treating pain half as well as morphine. Morphine's a much more powerful painkiller, but a placebo is half as effective as both? Saying a placebo will reduce pain reduces pain, but saying that the same placebo will increase pain increases pain. Believing that a placebo will make you feel better will make you feel better. Believing that it won't has the opposite effect. Now, placebos aren't just pills. They can be creams, injections, surgeries, or drinks. You can even get placebo buttons. They don't actually do anything, but they sure as hell make you feel like you're in control. But not all placebos are equal. The effect of the placebo is bigger when the pill itself is bigger. Or if you have 2 instead of 1. Or 2 once a day instead of 1 twice a day. And a capsule will usually beat a pill. And a syringe will usually beat a capsule. And anything with a big ass science machine can outperform any of them. A plain pill works worse than a branded one. A discounted pill works worse than a pricey one. And even a pill in a plain box does worse than one that's all shiny. Placebos that are blue work best as downers. And placebos that are red are better as uppers. Studies have shown that people who take their meds on a regular basis are less likely to die than those that don't, even if those meds are all placebos. You can even get addicted to placebos. In one study, a group of women took placebos for more than 5 years. 40% of them suffered withdrawals afterwards.
FDA drug testing requires 3 phases of trials, and by the second phase, these drugs are tested against placebos. Approximately half of all the drugs that fail in late-stage trials fail because they simply can't outperform placebos. So what exactly makes a placebo generate some of the same effects as real medicine? A number of factors can influence the effectiveness of a placebo, including a pill's color or the location of the testing facility. For example, when Valium is tested in France, it outperforms the placebo. But when it is tested in the United States, Valium tends to fail the placebo test.
In Germany, using a placebo to treat ulcers works better than anywhere else in Europe. But using a placebo that treats hypertension doesn't work nearly as well as it does for its neighbours. Now remember that all of this is about comparing things that both have nothing medically effective in them, which goes to show that a placebo isn't about what's in it, but about the beliefs that we load onto it. Our minds create the medicine.
This is Houston, Texas. It's here that surgeon Bruce Moseley has discovered something quite fantastic about the healing power of our own minds. And it's a discovery that has shaken the surgical world to its core. For 20 years, crippling knee pain has been treated by arthroscopic surgery, a procedure guided by a tiny camera which sees inside the knee. Most of us think of the placebo effect as a phenomenon that's triggered by a dummy pill. Our belief that the pill is real can sometimes provoke our body into healing itself. As strange as it sounds, Dr. Ray believed it was possible that the same healing power could be triggered by surgery.
I was just going through the same motions that I normally would as if I was doing the real surgery. As time went by and I started doing more of these, I realized that it was easier if I just had a videotape of an arthroscopic surgery that I had really done, and I'd pop it in the TV VCR and we'd start it running, and that's how I simulated a real surgery just as precisely as possible.
After 40 minutes, Dr. Moseley simply sewed the 3 cuts back up again, having done absolutely nothing to Sylvester's knee. And the results were amazing.
My skill as a surgeon had no benefit whatsoever on these patients. All 3 groups' results were exactly the same. They all did improve as a whole, but none of them were any better than the placebo group. So what we found was that the entire benefit of arthroscopic surgery for osteoarthritis of the knee was a placebo effect.
It's 6 years since Sylvester Colligan had his placebo operation. Before that, he was in so much pain he could barely walk. Now, his knee doesn't trouble him at all. One of the earliest documented examples of the placebo effect was 350 years ago. Charles II is said to have cured 100,000 people during his reign simply by laying his hands on them. The power of the royal touch diminished with the coming of science, but until 50 years ago, doctors had few truly effective treatments to give their patients. Michael Dixon, a family doctor from Devon who's written a book about the placebo effect. He's happy to admit he gives his patients placebos and says it's nothing to be ashamed of.
When I went into medicine 17, 18 years ago, it was actually quite part of the job to give placebos. That was fine. I mean, we were sort of slightly past the, you know, the blue and the pink and the green medicine generation, but it was okay to give placebos. We used to give nerve tonics, and certainly we did that quite happily. Now I give vitamin B quite a lot for people with tiredness, so to that extent I think I certainly give placebos myself. I think we are doing it the whole time, and we know we're doing it the whole time. Take up your bed and walk.
Dr. Dixon believes placebos have an image problem and that we need to think again.
We're very tidy-minded people, us doctors. We like to think that that drug is having that effect, and if the brain's interfering, it's a blooming nuisance, and we call it the placebo effect, without realising, of course, it's probably by far the strongest and most comprehensive drug that we have.
When Janice Schonfeld volunteered for an antidepressant trial at the University of California in Los Angeles in 1997, she had no idea that she was about to contribute to a breakthrough in placebo research. After the 8-week study, the doctors called her in to tell her the truth.
He said, well, you were on placebo. And I was very stunned. In fact, in my heart, inside, I didn't say this to him. I said, you're wrong, inside. But outwardly, I said, do you want to check that to be sure? Because I really think I was on the medication. He said, no, you were not. You were on the placebo.
Throughout the study, the doctors had scanned Janice to see what was going on in her brain. The warm colours in these scans indicate activity. The cooler colours, inactivity. And Janice's scans revealed that the fake antidepressant increased activity in an area at the front of the brain which regulates mood. It was a real surprise for the study's lead researcher.
What our work shows that in patients with depression who respond to placebo, it's not just in your head, it's also in your brain. It's a real physical process that changes the function of the brain.
And so it's not the dummy pill itself, it's the meaning we attach to it, and to the person that's giving it to us. Something which, in the right context, may just be enough to trigger a miracle. If the placebo effect is triggered by rituals, by belief, could we also find it outside medicine? Religion is steeped in ritual, and its healing traditions are far older than those of medicine. Jean-Pierre Belly, a French anaesthetist, had suffered from multiple sclerosis for 12 years. But during a visit to Lourdes in 1988, the crippling symptoms of the disease disappeared.
When I arrived at Lourdes, I could hardly move. I did almost all the pilgrimage on a stretcher. And then a kind of warmth slowly spread up from my legs and across my whole body. This warmth got stronger and stronger until it felt as if I'd been transported, if you like. I slid out of bed and put my feet on the ground and began to take my first faltering steps, but in a very strange way, like a child who is just learning to walk.
15 years on, Monsieur Belly is still well, completely free of the multiple sclerosis that threatened his life. But a stumbling block for placebo researchers has been the fact that only 1 in 3 of us respond well to placebos. It makes them less dependable than conventional medicine. But neuroscientist Fabrizio Benedetti has found a way to make placebo painkillers, at least, work for almost all of us. In this groundbreaking experiment, a brave volunteer is wired up to a machine that is about to inflict a brief but painful electric shock. It hurts, and volunteer Andre rates it at the top of a 1 to 10 scale. Benedetti then gives Andre an injection and tells him it's a painkiller. Andre is then given another shock. And he reports less pain. He thinks it's due to the local anesthetic, but it isn't. Professor Benedetti has lied to him. The injection wasn't a painkiller, it was saline solution, a placebo. He feels less pain because, unknown to him, the second shock was much weaker. The whole deceit is repeated a second time. The volunteer is shocked, given a fake painkiller, and then shocked again with a less painful shock. And then, something extraordinary happens. The third time, the volunteer is again shocked and again given a fake painkiller. But this time, the follow-up shock will be just as strong, just as painful as the first one. He shouldn't report less pain. After all, he's had only fake local anesthetic. But he does. By now, he so expects to feel less pain after the injection that he really does feel less pain. By conditioning his patient to expect a positive outcome, Benedetti has managed to boost placebo response rates from 30 to 90%. It's an incredible result, which opens up a whole new world of treatment possibilities.
In a very recent study, we gave both a placebo and a narcotic drug. And we found that it was possible to reduce the narcotic intake by about 30%, with the same pain relief effect.
In other words, you can slip a few placebos into a course of real treatment with no ill effects. And taking less real drug could reduce unpleasant side effects too. It works because placebos make our brains release natural chemicals called endorphins. They are powerful natural painkillers, almost identical to the drug morphine.
Humans do have the ability to recover from almost any form of illness. And I think this applies right the way through, and I would even include the possibility of our curing cancerous growths and so on through the deployment of an immune system in an effective way. I think people are quite much too quick to dismiss the admittedly anecdotal evidence about cancer cure through mind-body interaction.
And there's one case that stands out, not of cancer, but in a way even more impressive. This is East Grinstead. During the Second World War, it was known as the town that doesn't stare, because it was where servicemen with terrible facial injuries were rebuilt by Britain's leading plastic surgeons. But the Queen Victoria Hospital was a place of hope for those disfigured by birth too. And it was here in 1952 that a young doctor called Albert Mason was working as an anaesthetist, unaware that an interest in hypnosis was about to change his life forever.
One day I was about to give an anesthetic, and the case was wheeled in, and the boy, it was a young man of 15, was covered with millions of warts. The surgeon had been trying to graft skin from the boy's chest, which didn't have these warts, onto his hands. And he was kind of disgusted with himself because he'd made the boy's hands really a bit worse. So I said to the surgeon, being young and rather cocky, I said, why don't you treat him with hypnotism? Because I thought this was warts. And the surgeon looked at me pityingly and said, why don't you? And walked out of the theatre.
It's long been known that hypnosis can sometimes make warts vanish, although no one truly knows why. Mason himself had used the technique several times, with great success, and so the very next day, he hypnotized the boy.
And I said to him, the warts will fall off your right arm, and new skin will grow, which will be soft and normal. And I sent him away and told him to come back in a week.
When the boy returned, it was clear the hypnosis had worked. In fact, the change was startling. This is the boy's arm before hypnosis. And here it is after Mason had hypnotized him.
And I smiled and I said, well, that's very good. We'll go and show Mr. Moore, the surgeon. And took the boy around to the theatre. And Moore was operating at the time with the big glass windows there in East Grinstead. And I stood outside and I held up both these boys' arms, the one untreated and the one treated. And Moore looked, and his eyes became like saucers, and he handed his knife over to his assistant and came out, and he looked at this. He said, good God. I said, well, I told you warts go. He said, warts? This isn't warts, he said. This is congenital ichthyosiform erythrodermia of Brock. He was born with it. It's incurable.
What Albert Mason had done was impossible. This young boy had been born with a condition which made his skin thickened and cracked, like an elephant's hide. Victims suffer endless skin infections, which ultimately prove fatal. Most die in childhood. But Albert Mason's patient lived. New pink skin grew on almost all his body. It saved his life, and the young Londoner, who'd been badly bullied at school because of his strange appearance, was able to go home to a normal life, purely because of the power of suggestion, which is a key component of the placebo effect. When the case was published in the British Medical Journal in 1952, the world's media went mad.
Thousands of people phoned in. They had to put a special operator on the switchboard, letters poured in, and overnight I was in this bewildering situation. Time magazine came and photographed me and put it in there next to Katharine Hepburn. Every congenital ichthyotic within 1,000 miles came. There weren't many, it's a very rare disease. And I attempted to treat them, and none of the others responded at all. Not a smidgen.
Mason was never again able to repeat that first incredible success, and he thinks he knows why.
I now knew it was incurable. Beforehand, I thought it was warts, and I had a conviction, I can cure warts. After that first case, I was acting. I knew it had no right to get well. And, you know, I'm sure that was conveyed.
The case of the elephant skin boy forced Albert Mason to look beyond conventional medicine for answers. Today, he lives in Beverly Hills in California, where he's a top psychoanalyst. He last saw the elephant skin boy more than 40 years ago, but he's never forgotten him, and never stopped wondering what happened to him. After a long search, we found the elephant skin boy, who's now a 67-year-old man. He has no children, but is married and lives here in London. Amazingly, he's still clear of the terrible skin condition that should have killed him when he was a child. But Albert Mason never disclosed publicly his identity, because it was his patient's only chance of a normal life. It enabled one of the most celebrated cases in medical history to slip back into the shadows, and it's where he wants to stay. But in this one case, there lies hope for all our futures. For in this one case, everything came right.
Placebo research has been conducted across the world, and the findings have challenged some of the industry's most basic assumptions. The data on antidepressant drugs can be particularly disturbing. Since the 1980s, 2 large-scale analyses of antidepressant trials have shown a significant increase in the placebo effect. According to drug makers, it's not that the old meds are getting weaker. It's more like the placebo effect itself is increasing. The implications of the placebo effect are wide-reaching.
Incredibly, it turns out that the drug companies have known all along that placebos are great antidepressants. It's just that the data was never published. Irving Kirsch is a professor of psychology at the University of Connecticut. In 2001, he used the Freedom of Information Act in the United States to obtain data submitted by drug companies to support the licensing of 6 top antidepressants. His shock findings?
The difference between the response to the drug and the response to placebo was less than 2 points on average on this clinical scale that goes from 50 to 60 points. That's a very small difference. That difference clinically is meaningless.
Most immediately, it highlights how much we still have to learn about the relationship between a patient's mind and body. And there's still the possibility that an unknown variable could generate this perceived rise in effectiveness.
Some fascinating new research on what we've all known as the placebo effect. It's generally thought that dummy pills or sugar pills work precisely because so much of it is in your head and patients don't know they're fake. But tonight, results of a new study suggesting that secrecy may not have to be part of feeling better without actual medicine.
Diane Sanborn, a nurse practitioner for her entire career, knows all about the placebo effect. Still, she was surprised how much it helped her in this latest study.
This was like a miracle to me.
Many view the placebo effect as the strongest evidence for the mind-body connection in medicine. In studies of new drugs, patients don't know whether they get the drug or a placebo, a dummy pill. Often those on placebo get better. The researchers say this new study takes the placebo effect to a higher level.
It's possible to harness the placebo effect without fooling patients, without deceiving patients.
Researchers recruited 80 people, including Sanborn, suffering from irritable bowel syndrome, a condition affecting 10 to 15% of the population, mostly women. It's known to be brought on by stress and other psychological factors.
The treatment options are quite limited in irritable bowel syndrome, which makes it very difficult for doctors to adequately treat patients.
Half the volunteers got a bottle of pills actually labeled placebo and were told to take 2 a day. The other half got nothing. After 3 weeks, 59% of those taking the placebo improved, compared to 35% of those who got nothing. The scientists believe that some people get better simply from the ritual of interacting with doctors, including getting pills. Surveys show that half of all doctors admit to sometimes giving patients a placebo without their knowledge. This research suggests placebos may have a wider application as honest treatments.
A milestone evening, mind-body interactions. And I have to tell you, just in passing, that my own interest in this topic began more than 4 decades ago, and Dr. Spiegel, our speaker, doesn't know this, but when I was a medical student, I began doing experiments on the impact of social dominance on the risk for infections. Now, this took place in mice, but it was in the field that emerged as psychoneuroimmunology, a field that has taken place over the last several decades that Dr. Spiegel is one of the world experts in, and it connects some of the things that you've learned about already in terms of how our mind works, and will serve as a prelude to actually the first topic in the third quarter, which is the sort of basic fundamentals of immunology, the system that protects us from infection. And you'll learn tonight more about how our mind influences the outcome of disease. And the area that Dr. Spiegel has been most noted is, of course, in the interactions of the mind in relationship to cancer, particularly breast cancer. And his seminal work in this area, as it has been in many of the other impacts of stress on outcome of health, has really been extraordinary.
Use the mind to influence our brain and behavior, change the way we process pain, and change some of our behavior. And there are lots of other examples of this too. The word placebo actually is from the Latin "I will please." That's what it means. Many people are sort of contemptuous of placebos, but actually they're very powerful. In fact, I was at a meeting on the placebo at NIH, and people from Big Pharma were there, and they were tearing their hair out because you may have seen an article in Newsweek a couple of weeks ago about how there's a researcher in England named Kirsch who thinks that the effects of antidepressants are really all placebo effects. Now, they're not, but what has happened is this: 10, 15 years ago, when the newer antidepressants started to be used, about 2/3 of patients would get better, right? But half of those would get better with a placebo. So it was about 30% placebo, 30% antidepressant, and 30% no response. What's happened is, as people get more and more convinced that antidepressants really work, the placebo rate is going up and the pharmacologic rate is not. So it's now like 45 or 50% are responding to placebos and only 10 to 15 are responding to pharmacologic effects. Now, it tends to be people with the most severe depression, and it doesn't mean antidepressants don't work, but it means actually that the placebo is a powerful thing. And we ought to think more about the words we say to patients, because they have a tremendous influence on what happens to them. In those studies, everybody is in what's called a randomized trial. So it's the same population of people. They're all saying, I want treatment. They don't know whether they're getting a placebo or the real drug. That what's happened is people's general conviction that taking these drugs is going to get me better has strengthened. And so that means more of them are responding just to the expectation and less to the pharmacology, is what I think is happening. Now, there were a lot of articles in medical journals in the late 19th century about tomato poisoning. And there were many admissions to hospitals and emergency rooms for the results of tomato poisoning, because it was widely believed that tomatoes were a poisonous fruit. And so people got sick. They would eat a tomato, they'd start to throw up, they'd feel terrible. That's a negative placebo effect, or what's called a nocebo effect. And so expectation can work in either way. You know, it can make you feel better, but it can also make you feel worse. And there are times, you know, as a physician, I have to warn patients about all of the serious side effects of medications and also most of the common side effects, even if they're not so serious. I'm sure that in a certain proportion of my patients, I'm giving them a nocebo message, that they're going to get sick. And some people actually think the drug is more effective if they feel the effect in some way. But
the placebo effect's evil twin is a big issue. Called nocebo, it can do much more than reduce the effectiveness of a drug. It may even have the power to kill. 20 years ago, at a hospital in Birmingham, patients with gastric cancer were divided into two groups. One group was given chemotherapy. The other group was told that they were getting chemotherapy, but in reality received a placebo. Remarkably, 1/3 of the patients in the placebo group suffered the side effects of real chemotherapy, including hair loss and nausea. But one of the most unsettling nocebo stories ever was the case in 1974 of a man called Sam Londy. Sam Londy was a retired shoe salesman who'd been diagnosed with cancer of the esophagus, the tube to the stomach. Surgeons had removed what cancer they could find, but they were convinced it would return. Sam's prospects were gloomy.
In 1974, there were no survivors from esophageal cancer, so despite operations and whatever they could offer, then it was known to be literally 100% fatal.
When Sam died a few weeks later, no one was very surprised. But there was a shock in store.
We went to autopsy, post-mortem examination, and he, to my great surprise, had very little cancer. So he died with cancer, but not from cancer.
The autopsy found 2 tiny nodes of cancer in Sam's liver and 1 in his lung. But they were tiny, not enough to kill him. And incredibly, there was no trace of the cancer of the tube to the stomach that everyone was sure had returned to kill him. But if it wasn't cancer, what did kill Sam Londy?
He thought he had cancer. I thought he had cancer. Everybody around him thought he had cancer. I've kind of kicked myself through the years that maybe if I had said something or did I remove hope from him in some way.
Words and suggestion are a powerful therapeutic tool, but can also cause mischief. But this isn't just a matter of feeling worse or feeling more pain. It can change heart rate, blood pressure, it can change gastrointestinal motility. There are all kinds of real, think about it. The extreme example of the nocebo effect, you may have seen these, there's a phenomenon among some tribes called boning. When they choose somebody who's considered an unacceptable person for having transgressed some social norm, they'll just stand him over there and take this sacred bone and point it at him, and he falls over dead. I've seen films of this. It's probably a cardiac arrhythmia, but that is the extreme of the nocebo effect, where you just say, I think you're going to die, and they do. So it can have powerful medical consequences. The placebo is a powerful thing. There are groups now that are able to show what's going on in the brain, frontal cortex, to periaqueductal gray activation in pain control with placebo, which is the best established use of placebos. But our body is complicated, but our brain is very complicated, and it runs the show. And so there's no reason why the information we process shouldn't have effects through the nervous system on the way the rest of our body functions. And placebos are a powerful example of exactly that.